Well, good afternoon, everybody. Today is Saturday, January the 27th, 2024. It's about 4 o'clock in the afternoon, and I believe it's like 62 degrees outside and just kind of like cold and just dreary. Rain, a lot of rain. It rained a lot today, so just a lot of flooding. But it's a good time to stay inside, and I'm happy to report that I am post-op day number 1 from a laparoscopic cholecystectomy. I had it done yesterday, and it seemed to be, they finally found out what the issue was after 3 years of not knowing. So I have a great GI doctor. His name is Dr. Samavetti, and he is with Gastroenterology Associates on Dallas Springs. He is amazing and wonderful, and he found, the issue. It's a shame that it took so long. It's a shame it's been like 3 years of these symptoms, and things getting worse and worse. Neurological symptoms due to vitamin deficiencies, being misdiagnosed with exocrine pancreatic insufficiency without first checking the gallbladder function. And I do have these elevated tumor markers, and we're not sure where that's coming from. They're called chromogranin A levels, and they're neuroendocrine tumor markers. So it's not GI, where it's coming from. It's so it could, it could be other things. Other things can cause that, including taking proton pump inhibitors for 25 years and no GI doctor catching that. Those are bad drugs. If you're on those, I suggest you do everything you can to get off of them. Go to Pepsid, go to, an H2 blocker or something, but get off these PPIs because they can cause elevated chromogranin A levels. That's basically just like, you don't have anything wrong with you. You've just been taking this medication. It can also cause kidney failure, kidney cancer, pancreatic cancer, just all kinds of things. Some of these medicines are just poison, and the doctors are not finding the root cause. They just throw meds at you, and oops, we didn't catch that. It could cause you cancer, but we didn't catch that you shouldn't be on it. So really, really, educate yourself on the medications that you're taking. Also, I want to kind of bring awareness to everyone about this gallbladder disease. They call it the silent killer because it truly is. You could have these symptoms, you could not have symptoms and, have gallbladder disease. But once it starts failing, there are certain things you need to look for because chances are it's gallbladder, it's not pancreatic, insufficiency. I mean, you look for the most simple answer you can. So in my case, that was missed, and it caused critically low vitamin E levels. Nobody was monitoring my vitamin levels. They were just saying, you have exocrine pancreatic insufficiency. Now take these fat-soluble vitamins. We don't know how much. We're not going to check your levels. Here, just take them, and you're like, okay. So I took them, and I was in vitamin A toxicity. I had critically low vitamin E levels, and it's the gamma part of the vitamin E, so it's the gamma tocopherol that I was low in, and the main one that they look at is, I believe, alpha. So they look at alpha, but this is the gamma portion of the vitamin E, which some, doctors miss. So I was very low in that, which caused, all kinds of neurological symptoms, neuropathy, being off balance. I was diagnosed with ataxia by my neurologist, and that's where you're just like really off balance and uncoordinated movements, and you're like bumping into stuff. And, that was from malabsorption of my gallbladder function. I wasn't able to digest fats. So fats would just go right through me. It would take all those vitamins with them. The fat-soluble vitamins would just, follow what's called the steatorrhea. And that's what you need to look for. You need to look for fatty stools in the toilet. Yes, number 2. Fatty stools in the toilet that float and that are like difficult to flush. So they leave like these skid marks on the toilet, basically. If you have anything like that, if it's associated with a fatty meal or even just slightly fatty meal, that's gallbladder. So you need to see someone right away to get that checked. Mine got to the point where it was 14% functioning, and anything I ate, like just, you know, right-sided up here near your rib cage, radiating to the back and into your right scapula, into my right neck at times, causing terrible heartburn, sharp pains. I mean, it's a big deal. I ended up in the ER twice. Once I was admitted, you know, a couple weeks ago with malnutrition, with acute pancreatitis caused by gallbladder disease. And I couldn't get any of the surgeons to, you know, to listen to me and, you know, to understand the urgency of this, you know. And, you know, normally I understand you have to have stones, you have to have, you know, common bile ducts being blocked and, you know, emergent situations, but I was already behind the 8 ball. My protein levels are in the toilet, my albumin levels, my potassium levels, my calcium levels. I was spilling ketones into my urine. You know, it goes on and on, okay? So, and I was positive for this astrovirus, so I was super sick, you know. It's like, what do you want me to do? Go home and not eat anything? You know, just not eat? And they were fine with that in the ER at University of Tennessee Hospital, and fine with me going home with pain. So I went to see their surgeons outpatient in their clinic, and they understood the urgency. That, you know, the closest appointment was like 3 weeks away, so I just had to deal with it. You know, I just ate like chicken broth and sugar-free Jello and popsicles, you know, sugar-free popsicles, and then I would increase my diet to like put some rice in it, you know, rice in the chicken broth, and I would just like, you know. And Dr. Simovetti, I went to see him after I got out of the hospital, and he's like, if you don't start eating protein, you're not going to heal from surgery, so you need to do that. I'm like, I can't eat at all, you know. So I did my best. We brought, you know, Ray and I he got the best protein powder that he could find, you know, low fat. I used almond milk. I put a little bit of banana in there, and that was even too much. So anyway, so I had my surgery yesterday, and here we are. You know, I'm starting to feel okay. I had a cup of coffee with some cream in it, and then I had a banana, and I had no pain. So I took some Tylenol and ibuprofen, thinking that would, you know, be fine. It's been okay. And then I made myself some chicken breast and carrot fries. Yes, made out of carrots that I cut, and they're kind of like sweet potato fries. They're pretty good. I made them in the air fryer, and I've washed my face and you know, brushed my teeth and brushed my hair a little bit, and you know, I'm ready to take a pain pill because I don't feel. I mean, it does hurt. It's painful post-op. I'm hoping after today I won't have to take any of the like pain medication they gave me. I don't like it. They gave me Zofran with it, so it wouldn't make me sick to my stomach. But I have 4 areas of lap sites where they went in, you know, and looked with the scope and stuff. And they must have taken it out of this one here because that hurts terribly, and this one. So they use this like parachute material to pull that out. I watched it on YouTube. I had no idea that they did that. That was super cool. So Dr. Brian Daly and Dr. Megan Shepard, you are fantastic at the University of Tennessee. She's chief resident of surgery, and this Brian Daly has like a million different awards. So they did my surgery. I was really nauseated afterwards. Really nauseated. I mean, I was the last patient out of there. I know all PACU nurses hate that. They hate to get that patient. I was a PACU nurse for like 8 years. But yeah, I was the last out because I was so sick. And they treated me wonderful. They were sweet to me, just sweethearts. And, you know, sweethearts on 4 South too, where I was inpatient. I had some great nurses and some great care at UT. That ER is just, it has a lot of work to do with the way they treat people, with the way they update them. You know, when there's a long wait, they need to update families. They need to update patients. That's what you do. I worked in the ER for 8 years also. We'd give, you know, patients pagers when they would check in, and if we needed to talk to them or call them, we would page them. Every time you call somebody in an ER waiting room, that's a HIPAA violation. Well, UT is doing it constantly. So anyway, just keep that in mind. And on that note, I hope everybody has a wonderful Saturday, a wonderful weekend. And from what Dr. Daly says, I'll be able to start hiking way before 8 weeks. So I'm excited about that. And thank you, everybody, for your support and everything through all this. It's been holy hell. You know, it's been terrible. And I just look for things to get better and, you know, just to get back to myself again and just do awesome. And hope everybody has a wonderful weekend. And take care of each other and take care of yourself. And I'll see you on the trail. Peace.